on the paper that you saw, we're going to talk about what music therapy is and isn't, what music interventions are. Um, we'll talk a little bit about theoretical frameworks that support music interventions, and I'll talk a little bit about the framework I operate from as a music therapist often. Um, talk about different interventions for a variety of different age groups. Talk about contraindications, which I'm sure you probably have a couple of ideas of what that looks like. And then the goal that I had earlier. Oh, let's see. There we go. So first off, a couple of questions. So if y'all could just chat in, what theoretical frameworks do you utilize in your practice currently? Motivational interviewing, okay. CBT, CBT solution focus, cool. Person and environment, great. Okay. Narrative, awesome. DBT, perfect. Okay, great. Next question. Yep, okay, holistic focus. How many of you have heard of music therapy? And can anyone define what it is? Family systems. Or give us heard of it, okay. Using music as a way to process emotions. Yep, that's part of it. Co-led sessions with music therapists as I'm CTRS. Okay, awesome. Yes and no. Okay, great. That's awesome. Y'all are doing great. This is going to save us some time for the fun stuff. How many of you use music in practice, and in what ways do you use it? Group setting to process the four big feelings associated with great. Assist with mindfulness, connecting to clients and calming. Meditation tunes to support clients, great. Use it with individuals with dementia and found it as one of the best modalities. Okay, great, Angelica. Great. Awesome. So kind of a whole variety. I make good mood playlists with adolescents. Some clients bring in instruments, means of sharing and processing thoughts and feelings. Okay, Miss Butler, that's really great. We can talk a little bit about that, especially in regard to like improvisation, what it is, and ways of expanding on that. Great.
Some clients want to listen to music related to recovery.
Yeah. Yeah, definitely. There's tons of music for that, which is great. I don't know who said that. I heard kind of a ghost voice. But yeah, exactly.
Christina Velasquez, CSB.
Okay. Thank you, Christina, for sharing. Yeah, absolutely. Um, so kind of going on, let's see. So what exactly is music therapy? Music therapy is the clinical and evidence-based use of music interventions. For music therapists, we tend to focus on songwriting, um, music and lyric listening, discussing, and analysis, music and movement in a variety of different ways, um, active live music making, where maybe we play along with a recorded song, maybe we play an actual song together with a variety of different instruments, different skill levels, sometimes passive music making. So we might be kind of listening to something, body percussion, singing along, and then improvisation, in which we create something in the moment, we just see where it goes. And a lot of these have been studied, researched over time. And just kind of like a lot of the work we do, a lot of it is clinical and evidence-based. So just kind of clarifying that. Um, the other thing too is that it's, of course, oops, sorry. It's done by a credentialed professional who has completed an approved music therapy program. So this essentially means that this individual holds at least a bachelor's degree in music therapy from one of 80 AMTA approved college and university programs. So in the state of Virginia, that would be Radford University or Shenandoah University. There are three main competencies that are focused on musical foundations, clinical foundations, and the music therapy foundation. So what that looks like is pretty much most people who go into this field have a musical base. So when I went in, I came in with a primary instrument of voice and violin. And so I was still required to do recitals, juries, sight singing, ear training, music theory, all of those things. And then I had to be proficient in guitar and piano and then other instruments so that I could facilitate live active music therapy interventions with individuals. And then on top of it, we did more of the clinical stuff. And then I was required to do like an anatomy and physiology. With that as well, you're required to do 1,200 hours of clinical training, including a supervised internship. So this would be kind of like considered a residency of up to about 6 months. And then you're eligible to sit for your board certification exam. If you do a graduate level coursework, oftentimes you're focusing on advanced clinical practice and research. So for me, I went to Radford for my master's. The focus, I did a lot of counseling coursework, along with learning about like psychoanalytic music therapy, vocal psychotherapy, stuff in that realm as well. So in general, how I think as it pertains to me as a music therapist is one, music is an energizer and organizer. Research has found that music lights up both sides of the brain, both the left and the right side. And so oftentimes rhythm, melody, all of that can really help organize us, especially like just naturally. We naturally sway to music. We naturally fall in step to music. We often feel moved, sometimes consciously, unconsciously to music. Marching is a way of organization. Even just being able to kind of focus a little bit. If there's not a whole lot going on in the music and we're doing meditation, we're able to sort of focus on the breath with music as a support. Whereas if there's a lot of stuff going on in the music and we're doing meditation, that might be kind of interesting. We kind of have squirrel brain. And then the next part is that there's this really interesting complex relationship between the client, therapist, and music. The music therapist and the client is pretty given as therapists, right? On this side of the fence is we've got a relationship with the client has a relationship with us, and that dynamic makes sense. But when you add music, it's kind of interesting. The client has a relationship with the music. And they bring in all of the stuff. There's music that they like, there's music that they hate, there's music that triggers, there's music that really motivates and makes them feel good. Music therapists, who are also human, have a relationship with music as well. And so how might we respond to a client's music or preference? Also, when we pick our music, are we picking it for the client or for ourselves? Or is it both? Or how might music also interact with the client if we're making it organically and they hear something? We might have a focus in one area, but we're kind of going over here. So I'm always kind of looking at what is happening within that relationship. And maybe similar things to this might be if anybody has done sand tray or even arts-based activities. You know, what you previously had planned kind of goes off somewhere else that's more important. Oftentimes music is a vehicle. Another thing to talk about is, so the one that everybody knows is, music, the music therapist is the therapist, and music is the intervention, which is what we're going to focus on today. But as a music therapist, sometimes music can be a co-therapist and sometimes music can be a therapist. So when music is a co-therapist, this is particularly when we're working with a client and something interesting musically is happening and the client is actively engaging organically with it. The music might actually kind of co-facilitate where we go. And then me as the therapist, who's the co-therapist watching what's happening with the client, I might try and intensify, amplify, speed up, or slow down. When it becomes music as therapist, this is particularly if maybe a client is having a catharsis or a moment in which they're feeling very deeply in the music. I don't want to be in the way of that. I know that the music will resolve in some type of way or have a buildup or even kind of coming down. You know, music has this way of helping us breathe in and out naturally. So, what that might look like is I allow the music to do that. And if we were doing, you know, say some guided imagery where the music was coming in, I might say, yeah, that's it. Really see if you can invite the music to support you, or see if you can invite the music to hold you in that space. So it's a really interesting dynamic, and music therapists in particular focus a lot of attention in that, um, and kind of how we kind of look at our practice as therapists. When I'm not actively using music, I often am thinking about rhythm, volume, timbre, voice, of the clients I'm talking with and what they're presenting to me. So I'm always kind of thinking musically, and it's almost kind of automatic because I've been trained over the years to do that. So theoretical frameworks utilized, pretty much all of them, but I'm going to just talk a little bit about what they look like. So CBT, mindfulness based, thinking about cognitive distortions, thinking about schemas, maybe even um, behaviors, thinking patterns, and emotions in that dynamic. You can do a lot of really interesting things with listening to music and talking about it, but you can also do a lot of really interesting things with songwriting as well. Dialectical behavioral therapy. I love dialectics. Two things can be true at the same time. Everybody thinks, or most people think, to have music, it has to be in tune, it has to be perfect, it has to be in rhythm. And in reality, what makes music so interesting and so accessible for expression is that there's a lot more nuance to it. And you can't necessarily just have a pretty sound all the time. There has to be some emotion between it. So you can use this in a way of talking about, we're not paying attention to this rhythm over here. Like, what's happening over here? Why is it a little bit off? Let's see if we could pay attention. Let's work on that distress tolerance. Or let's work on radically accepting that these two things that don't always sound great can happen at the same time. A great example of this was when I was working at Newport News Behavioral Health. I would work with a lot of boys, had a lot of trouble staying on task and listening. So we would do active music making with like drumming. And the whole task was to stay in where we could create music that sounded good. So it did not sound pretty, but we were in rhythm, and that was a success. So two things can be true at the same time. Did not sound pretty, and also we were in rhythm together, which was a huge success for us in building community and group with each other. Psychoanalytics. So again, music has a way of stirring up these feelings sometimes unconsciously for us. About a year ago, I was working with somebody who came in, they didn't understand why, certain music would come on in their car and they just start crying. So we did a little bit of exploration about the music. A lot of it was tied into his identity as a father and also his lack of having a father himself and having a grandfather and not feeling like he could stand up. So we did a lot of really interesting things with music for him. And I also did a lot of arts-based interventions as well. Internal family system. So for the person who talked about instruments, this is kind of a great place to do internal family systems. You can use instruments to describe maybe like, what does a critical voice sound like to you? Or what instrument would you pick, or the one that's wanting to protect and run away, what would that sound like? Maybe they might pick a tambourine that goes really, really fast, or like a really quiet shaker. You can do really creative things to talk about that and process. Gestalt in the moment, here and now. What song might you use to have that hard conversation with your mom about her having an opinion about how you raise your kids, and using that as a way to discuss it in kind of a fun way that kind of takes away some of the pressure, but also allows for the space to explore safely. And then finally, solution focus. So what are the strengths of our clients? Maybe they are musically inclined or they really like music, and how can they use music as a support for depression, for anxiety? How have they used music in the past that was useful, and what happened? What happened to that use of music? So what is music therapy and what isn't it? So again, it's practiced by somebody who has an MTBC, and protects the public by ensuring competent practice and requiring continuous education. Very similar to social workers, recreation therapists. I saw one of y'all on the talk. All of that. It's pretty much the same thing, making sure that there's an education that, when we use music in a therapeutic setting, a rehabilitative setting, we want to do no harm. The use of music therapist and co-therapist. So using that, what I said theoretically would happen, thinking and practicing in a musical way, which I already mentioned, and then a clinical approach to meet specific goals and objectives for clients. Again, a lot of this feels similar, and also it's kind of different as well. So these over here, a person with Alzheimer's listening to an iPad with headphones of his or her favorite songs. It's a really popular one. It's not music therapy. It's more music therapy if it's interactive and we're actually working on a goal. It might be therapeutic in nature for that person to listen, and that could potentially be homework, but there'd be a specific treatment plan as to why it is that we're doing what we're doing. iPod therapy is great, but what really would help somebody with dementia is that engagement, and that connection and interaction. Groups such as bedside musicians, musicians on call, music practitioners, sound healers, and music thanatologists. Music thanatologists have their own sort of practice of using music specifically for end of life, so it's not the same thing. There might be similarities but also differences. Celebrities performing in hospitals and or schools makes people feel good, not therapeutic. A piano player in the lobby of a hospital, nurses playing background music for patients, artists in residence, arts educators, a high school student playing guitar in a nursing home, a choir singing on a pediatric floor of a hospital, and using music in a therapy session and calling it music therapy. It's still an intervention, but it's not music therapy. And it's kind of like the same thing, like, oh, I do art therapy. Well, no, you're not. You're using art as an intervention, but the art therapist is thinking artistically as well as clinically. And it's kind of like an important distinction, because there is a certain, it's almost like when you get very advanced training, like for EMDR, you can't just say like, oh, I do EMDR. You might do aspects like with bilateral stimulation. Like I talk quite a bit about that some with clients, of using that when we're doing affirmations or something, but I don't do EMDR whatsoever. I don't think like that. So because there's so much work and effort and training that comes into it. Now, with all that being said, because I don't want this to feel like a lecture, like I'm poo-pooing on anybody who's called a music therapist, the music therapy when they're doing it. Music is not owned by music therapists. Art is not owned by art therapists. Drama is not owned by drama therapists. So that means that we can be creative and just kind of know what our scope is, just as we are as therapists. And then also music can be therapeutic for clients if we understand how it is used clinically and know any potential contraindications for use. I think that's like one of the biggest things, to really understand is it's not owned by us. So if you have any anxiety coming back of like, oh, I called it music therapy, whatever, don't worry about it. Like, you're human. This is education. Just as much as I know for a fact in the past I probably called doing like an arts intervention as art therapy, and really it wasn't art therapy. So it's okay. Um, so I know I kind of went through this part fast, but I really want to get to the interventions, and I can also take a couple of questions. But after learning the building blocks of music therapy and music interventions, what questions do you have so far?
Hello.
Hi.
Hi, this is Natasha Haskins. Thank you for your information. Um, I've been one very guilty of listening to music or participating in art, thinking it was therapy. I guess it's therapeutic as the recipient, but it's not officially therapy. So thank you for making that differentiation. I believe a lot of us, if not all of us, confuse the two.
Great. Hey, thank you for sharing that. Yeah, very much so. Like music. So, the thing of it is, music can be therapeutic, and we do interventions on ourselves all the time. Coping skills, whatever you want to call them. I have to like figure out what the wording for it is. But what I find is, it's kind of like about what the goal is and what specifically you're working on, which makes it clinical. So, if we're putting on music to make us feel good, that's fine. You can, and if it's for you, you could totally call out music therapy. Like I don't correct clients. They're like, yeah, I do music therapy by list. That's fine. I don't correct them. It's more so when I'm working with other like professionals where I'm like, I wouldn't call it that. So I really appreciate that.
And I do have one quick question. So I heard your background, um, in how you entered the realm of music therapy as a professional. Do you also have to have a similar credentialing history in order to incorporate musical therapy with your own clients? Or is there another type of certification that you have? Or do you have to have any certification in order to perform music therapy?
Yes. So I'm guessing you might have missed the first half. So you
I
have
did. My apologies.
no, it's okay. It's all right. There was a lot going on this morning. Um, so lots of grace today. Um, so in order to become a music therapist, you have to have a minimum of a bachelor's degree in music therapy itself from an approved American Music Therapy Association university. So in the state of Virginia, that's Shenandoah University and Radford University. And there's three components to it. So it's music, music comprehension, performance. So a lot of people who are music therapists have a musical background. Um, Theoretical framework clinical work, and then music therapy clinical work. And then you have to also complete 1,200 hours of clinical practice, which includes a 6-month internship. And then following the 6-month internship, you then sit for your board certification, which you every 5 years you have to re-credential. And then there's so many hours you have to do. There are some folks who have a music background, so say in performance, music education, or some type of music something or other that choose to do music therapy. So sometimes there's like a graduate equivalency program in which you can do that in 2 to 3 years. Um, but typically you have to have an MTBC to do music therapy. There's a lot more training now, which is pretty exciting to me, on creative arts therapies and utilizing them in practice, um, which you can also utilize. And luckily, again, music's not owned by anybody. You might even find that in some of the coursework. I think I was talking to a mentor of mine who did a EMDR training. She had done a training that was both EMDR that also incorporated arts-based activities for bilateral stimulation, processing, X, Y, and Z. Great question.
Awesome. Thank you.
Okay.
If I can add something, you had mentioned earlier about like people saying art, I do art therapy or I do music therapy. Really, it's important for every professional to know their therapeutic, their ethical limits. So
Mhm.
it's not really okay at me as an LPC to say that I'm not trained as an art therapist or a music therapist to say that I'm doing music therapy. I can say I do art or music interventions.
Mhm.
And that's really important because if we say it the wrong way, that is we're saying that we're somebody that we're not. And
Mhm.
that's important to kind of clarify.
Yeah, thanks, Karen.
I had a question too. This is Latasha. Hi,
Hi,
and hi, and awesome presentation so far.
thank you.
Regarding the music therapy, like, are you specifically like playing songs, or are you playing like certain sounds? Like, I hear like there's certain music that's like healing music. Like, I don't know if it's like certain hertz or whatnot. Like, can you just play that throughout the session low? Like,
So, so again, we're thinking clinically, right? And oftentimes the other thing too is I try my best to do client preferred music. Um, you know, everybody has a preference. And some things relax folks and some like that are kind of across the map. Like the general thing is like, oh, calm music calms people down, but not for everybody. Some people actually relieve a lot of stress and anxiety and anger and stuff through like heavy metal and um like K-pop or whatever else. And so it's really about investigating like what is it? How do people relate? How do our clients relate to music? And in what ways do they use it? And how can we integrate it? So it can look like a variety of different things, Latasha. So it might be that, and you'll find this out in the next portion. It might be that we just play music that they like and talk about it. It might be that we sing and play. We actively, a lot of, pre-becoming a licensed social worker before I was really focusing on that coursework, I did a lot of live music making. So I would recreate the song and we would play it together, sing it together, rewrite the words, all of that. Um, and go from there. We'd even have discussions about it. It was really about in the moment music making and seeing what organically happened, especially like even with groups as well. There's so many things that can kind of happen that can spring up that's very creative. But it also might be, like you said, like you could have something lower in the background, but think about why it is that you're doing it. Because sometimes I might, if I'm having a low day myself, um, especially when I was pregnant, I have these days where I just didn't have energy. I put very, very, very low in the background music to kind of just support me so I could be present. But I also was thinking about the client. If the client was sensory sensitive and they'd be able to pick up on it, I'd just turn it off. It would be too distracting. Some actually might find it really comfortable and kind of like deepen into what they're doing. Sometimes it might be that I put on a piece of music while we're doing some type of like somatic um, intervention or meditation. So I might say, while we like sit here and breathe, what if I just put on the short 2-minute piece of music? So it really depends on the individual. It really depends on preference of music. It depends on kind of where you're at too. So it looks very differently. And sometimes it's pretty chaotic, especially if I'm working with kiddos. Um, I was working with somebody who just liked all of the instruments. And so it was like a play therapy session, seeing what resonated to them and then seeing if I could have a conversation. So sometimes it was spontaneous singing. And I would get them to talk through singing because regular talk wouldn't work. If you were playing games, it wouldn't work. But singing randomly, I'd get to hear about their anxiety, their sadness, their frustration. And with a guitar, piano, drum, whatever else, I can meet them immediately where they're at. And then we could kind of stay in that space for a while and then come up with some solutions. So that was probably a really long answer.
no, thank you. I appreciate it.
Okay. Okay. We'll see what else there is. I have a couple other questions. Do any fears come up about music in therapy as we're talking about it?
Yeah, I think I have one. This is Heaven.
Hey, Heaven.
Um, hey. So just in general, like before using music, I always try to think about beforehand, okay, like clinically and ethically, am I able to support them like for whatever comes up from the music, because I work in a substance abuse facility. And a lot of my work is group work, okay? So then it's like certain songs might elicit certain memories that clients don't want to process in a group setting. And so like just being mindful about the songs that are used.
Yeah. Yeah. Yes, definitely. And that's great that you think that way. In particular, sometimes like if I do groups with folks, I might set specific rules for what songs are picked. So when I was working in a teen setting, a lot of it was like uh no songs that were particularly like that glorified violence, that glorified drug use, that glorified, demeaning language, stuff like that. We might also very specifically pick songs that we find uplifting, more so than songs that make us feel, sad or bad. If we were to pick a song like that, typically it would be one song. It wouldn't be a group picking different things. And like, it's depending on the environment too. Like I would have to, especially working with my teens, I'd have to quickly look at lyrics just to make sure. But also in that dynamic too, it really makes things interesting of having that conversation about distress tolerance and all of that. But you're absolutely right, which I'll talk about. Music itself can really, like, different things can really trigger people to go into a place, and depending on the goals of the group, and the site, it might not always be appropriate. So I think it's great that you really think about those things. And I totally feel that. I even sometimes get a little bit anxious, and I've been doing this for a number of years. And it's truly about not doing harm and having a backup plan.
I like to think about how I have no control over what memories it brings up. When you use a song, even if it's a happy song, sometimes it's amazing how I can hear a song from when I was in high school and I'm there, which generally is a positive thing, but I don't know what anyone else is experiencing unless they tell me, hey, this musician always brings this, experience. And so that's an area that could be a fear or a sense of like I don't have as much control over.
Yeah. Yeah. And this also brings up like the why it's so good to really watch how the client is responding non-verbally, watching their posture, watching their face, watching if they swallow or not, if they're getting tearful, all of that. With music, you can have an immediate effect. And as a both as a therapist and a music therapist, we want to kind of jump in at the appropriate time and investigate what's going on and figure out what to do. So exactly, like also watching that, knowing that you don't always have control, and also relying on the fact that you're, if there is a concern, making sure that you plan for time to help ground and reintegrate what's happening at the end. Any other fears that come up? Okay. Was there any information that inspired you so far to consider use of music in therapy?
Yes, this is Stacy. I think all of the above. I work with elementary students and they're going out for the summer soon. And I was just in a meeting with my supervisor asking me what was I going to do, what was I going to do to engage them. Um, and so I thought about as you were talking, I was like, oh, this would be good. And I appreciate you saying not therapist, but intervention. And I can use kind of, I think what I want to do is try to explore it now while we're in session and see how it goes to get their input on what they would like to do. Like you said, either writing music or pulling music, or even polling them to see what type of music they like. So I think that's going to help me, and I could share with them that we're just using this as another intervention to like work on frustration tolerance, or you know, a different coping skill, because I've been using the same ones over and over and over. And I think I think honestly, I think they're getting tired of let's take a deep breath, let's count back. And so just to have a different tool in my toolbox, I think that would help out a lot.
Yeah, and even just talking to you, like thinking about like creating a summer playlist that reminds them of the coping skills that they've been working on, that they can even practice them while they're listening to the music. Or even picking a summertime song that you know, cut up the lyrics to, and you create a song based off of those lyrics. Doesn't be that they sing it necessarily, but that maybe they read it, or it's something kind of positive. Um, yeah, you know, summertime can be fun, but also thinking about some of the kids that are in the school setting, it could be kind of stressful because the supports and resources that they typically would have, they're not going to necessarily have. So finding ways of doing that, and also thinking, you know, if they make a playlist, how, where, and how can they access the playlist? Um, so that's great. Okay. Um, anything else? Like, I know we started a little bit late. It's 10:53. And this would be kind of where I would take a break, but before we sort of do that, any other questions or thoughts?
I was just going to say, I love the idea of a playlist. I do a lot of substance abuse counseling, and the clients themselves have recently started bringing in a lot of sober music. Well, that's what they call it. But
Yeah.
either it's a lot of people who out in public are talking about being sober, or their lyrics are specifically about being sober. And so I incorporate a lot of that and let them play it. And then the amount of people who come back to the next group and say, I was having a rough day, I pulled that up on YouTube, I played that song, it really helped, it really inspired, it really reminded me what I'm doing and why I'm doing it, and that I'm not the only person doing it, because it can be certainly very isolating, especially when I do a lot of virtual work, so I don't actually see
Yeah.
people in a group, and they say, oh, hey, I felt connected to this group. I felt, I remembered some of the things we talked about, and it's a really great tool. So I've started to kind of incorporate some of those, but I invite them. It's different with adults. I'm not so concerned about, the cursing and the lyrics and things like that, but to kind of bring in music that inspires them and things they can, when they're not with us, when they're not able to log on, utilize and stuff. But I like this idea of maybe like I think someone said something about recovery, but like a recovery playlist, because it
Yeah.
can be really hard when you're in a space and you're trying to find anything out there in media that supports where you are, either not using, not drinking, or even, not having certain emotions or certain, negative coping skills, or being involved with negative people, or treating women in a negative way. So anytime I find songs and lyrics that really do kind of speak to what we support, I try to keep a list, because that's really one of the things. I don't see people out there like me, this is what the clients are saying, who have the same message. It's all about violence and drugs and, what you can do and who you can hurt and what you can get and the money and the, especially with like the young 20, they have a certain subset of music they like to listen to.
Yeah.
And it's not always very supportive in terms of what they're trying to do with their counseling. So, but I'm excited. I want to start suggesting like playlists to them too. So
Yeah,
thank you.
absolutely. And just a song popped into my head. There's a song by Sia, I think it's called Courage to Change. She actually does quite, like, some of her music in particular talks about substance abuse and her difficulty with it. And also some of her music videos as well. Some of it's a little triggery, trauma-based. I wouldn't necessarily suggest playing the videos per se. But she does one about courage to change, which is great for 12-step, including Al-Anon, all of that. But also like even for the folks who bring in music, that's not always the most like, it's sort of the opposite direction they want to go in. One of the things that I was talking a little bit about earlier, in particular, like with the frameworks and lyric discussion, is you could say like, okay, so the person who's singing in this song about drugs and whatever else, if they were your friends, what would you say to them? And what are some of the consequences of what they're doing? Do they talk about the consequences? What are the blaring red flags that you're seeing? You know, given your recovery, would this be something that was easy for you, or do you think you get pulled into it? So you could actually talk about that in a way so that when they're listening, you know, because some of the songs might really be challenging for them, it gets them to practice challenging the thoughts and lyrics of other people. So you can also do that.
It was interesting. One of the last groups I did, somebody came in, and when we kind of do our little check-ins, they said, I found out this great thing, this band I follow. They just came out as being sober as a group. They let their lead singer go because he wasn't, but he was kind of shock and awe. Like, it was the most amazing thing to have this band that I follow talk about this goal that they have, and just how very few, sadly, how very few adult media role models in that kind of environment there are. And he really was inspired by that and really kind of took that to heart. So it was, yeah, it was good. So I encourage them to kind of continue to seek those things out, because it's obviously not as well publicized. Like, no one cares about the person who became sober. They want the train wreck because that's what's on TMZ, you know? So
yeah. There was also oh gosh, I can't, Florence and the Machine, also sober. Her last album talks a little bit about that and anxiety as well. And she's been talking about her sobriety. So another conversation starter. So I know some of you use music in your sessions with your individuals. How do you utilize music in your sessions? Is it as an incentive? Is it as a background? Is it directly as an intervention? I know I've heard a couple from you, but I'd really like to kind of know how y'all are using music, if you do use music.
there's a comment in the chat about that. I didn't know if you saw it.
Oh, here you go. There's an all music producer, artist, and a create bot. Awesome, Eddie. Oh, cool. That's awesome, Eddie. Thank you for sharing. I'm curious, you know, just to chat, Eddie, like, you're a music producer and an artist. Do you ever like try and create in the moment with some of your individuals? We could, I'm gonna do a slide on it, but I'm curious if you ever do that. With oh. So haven't for the as a background. So Catherine, to answer your question, so I used to work with individuals with intellectual disabilities and developmental disabilities, variety of different ages. And it was really useful for some specific skills. So some of it was turn taking, some of it was more educational depending on what was going on. When I was working particularly with a group of individuals who were at a day facility program, a lot of it was emotional expression. I also used to work for Versability for a bit, and some of it was learning independence skills and singing about them. And some of it was more recreational. So it was about making fun or having fun, having new experiences, learning fine and gross motor skills, all of that. And in particular, with somebody with maybe an Alzheimer's or dementia diagnosis, it might kind of look kind of similar but slightly different. You know, if we're trying to regulate or calm, we might put on music, and it might be more passive listening, especially if that's something that helps them, or it might be kind of more active in which we're engaging with them, so they have a social component. So really depending on what the goals are and the needs are, you can sort of do those things. Let's see, Marchette says discussions on anger, self-esteem, and educational processing of lyrics. Great. Latasha, I haven't yet, but was thinking of incorporating backgrounds to the music, like the calm music, green, brown noise, classical music, jazz music, or music that did not have words, just to enhance relaxation. But now I'm not so sure. Okay, Latasha, totally can do that. Completely fine. You know what I typically do? I like to sometimes have essential oil going in my office, and I get nervous about that. So how I kind of tap it down is I just ask if that's okay. Like, hey, do you mind if this is on? Most of the time people are like, yeah, this smells really great. Or some people are like, no, my nose is sensitive. Like, so I turn it off. You can do the same thing with music. Just do a little check-in. And then also, like, if they're listening and they're finding it calming, it's great to talk a little bit about what makes it brown noise, uh what's useful about using calm music, how to utilize. You could throw in psychoeducation. So Latasha, I see your nervousness and your anxiety, but I still think it's a great idea. Just do a check-in. Check-ins are great. And you could trust your client. And if you see that they're visibly uncomfortable and they're not saying anything, check in, say, I'm wondering, and they might then say. Eddie, no, I don't. Being that I'm an artist, I can get cited for conflict of interest. Gotcha. Okay. Gotcha. I see what you're saying, Eddie. Okay. That's kind of interesting though. I guess it's another aside conversation. And if you ever want to just chat shop, reach out to me and we could talk. Natasha, I feel like that great to check in initially beforehand. Great. Awesome. Glad I can help. Oh, do you bring in pre-selected music or do you use individual preferred music? So I know a couple of you said like using music, discussions on anger, self-esteem, educational processing of lyrics.
Hey, Leanne.
Hey. Oh, not for me. That's for somebody else.
Yeah, someone named Leanne. Please.
Oh, she probably went to the bathroom. Oh my God.
Oh, I'm gonna go ahead and mute you. Sorry about that.
It's okay. So are you bringing in your own music and just kind of having it as a discussion, or are you doing kind of individual preferred, so you know their favorite artist type, X, Y, and Z? Is it a mixture of both? What are folks using?
Hey, it's Heaven. The way that I've done it's a group we call, Big Feelings. We follow along this personal journal recovery book. And there's a chapter dedicated to the 4 big feelings. And so I always have my clients, like, I bring in like little bowls and I have them write down songs that make them think of those 4 feelings. And then we'll listen to the lyrics and then process like what that's like for them. Like, what does that mean for them in their recovery, things that they can relate to and things like that. And so mine is more individualized. Because they're all from similar backgrounds. So they kind of have similar music taste. Yeah.
I love that. That's great. That's a great intervention.
Thank you.
Hey,
Anybody else?
Nicole.
Oh, hey.
This is Marchette. So
Marchette.
I was taught when I was bringing up the different examples of how I use it for anger. I have some kids that, over the weekend, they do different things. They listen to music or watch movies. And so when they come in, they're so excited. So using the music, bringing out the lyrics, and then doing some education, like, well, what did this person really do? Were they advocate? Were they activists? Were they to have them to look at not only the lyrics, because that's something that as artists they came to be, but also educating them on who that person was. That's why I really enjoy when you were talking about the substance abuse and the different artists, especially the sober artists that are used, because it educates. And then I have some clients that have ADHD, and they listen to this real fast-paced metal something type of music, and I can tell with that, their energy is real high, and trying to see if we can use that energy in a positive way, because they're also playing these games, and then this music is in these games, and then trying to learn about different feelings under the anger. So if you have anything about any of that, I'm a music lover of all genres, so I'm open. Like I said, I have clients, we have a keyboard, they play piano.
Awesome.
I really try to engage them in the things that they are, um, where their strengths are, I guess. And
Yeah.
try to bring out conversations if they love music, poems, writing poems, because that's a way into music, sharing feelings and thoughts about that. So
I already have one idea. So you could with poems sometimes, either something that they wrote or something that they're reading, you can make a sound poem. So as they're kind of reading it and you and discussing it, you could figure out what sound or sounds or music could go underneath. I actually have an example of this where I was working with a group of veterans. All of them were songwriting, and one of them was truly a poet. They didn't think in lyrics, but they thought in poetry. So they wrote a poem about their experience of coming home from Vietnam. And so as a group, they all came up with different sounds to go underneath the sort of the excitement and nervousness of coming back, and then being greeted in completely the opposite way of what they expected to be greeted as, and then sort of like going into, back to civilian life. It was very powerful. The group together came up with it, and it was recorded. So you could totally do sound poems, which kind of deepen and get talking. You can also, folks who write songs and stuff, and this is what I'm kind of thinking about with Eddie, if he has any people who like to create music and bring it in, is you could also ask them like interviewing the musician, like, so tell me about your process of writing this song, like what inspired you to do it, tell me about this lyric, does it remind you of this? I had a lot of fun doing that with some of my teen boys and girls who would come in, particularly my teen boys who really liked rap and beats. They would want to create something. And so periodically, after the process of doing that, I'd ask them specific questions. I'm like, tell me about this, because you were in Richmond, you're here now. Like, what does this mean? And I hear you referencing your grandmother. Tell me about your grandmother. So you can really extend on these things. And I love that you do research on the artist too. I think that makes a huge difference sometimes, because you might even find, like, when you learn more about the artist, you might hear more in the music, and that makes it more tangible and relatable. So thank you, Marchette, for your share.
thank you.
Okay. So we're already talking. I'm going to skip that. We already talked a little bit about hesitancy. Let's see. Are you going to move? Is it doing this? Okay. So first off, individuals do not need any previous experience with music to benefit. So these include your clients and these include yourself. You know, I come with a music background, so things are a little bit more accessible and easy for me. I realize that not all of you do, but you can still use music as an intervention. And typically, just like you follow your client, you can do the same thing with music. So, if your client is musically talented, that doesn't mean you have to be at the same level. Or if you're musically talented, that does not have to mean that they're on the same level. It's really about meeting them where they're at. So first off, what is song listening and discussion? I think this is important just to define. It's listening to lyrics, tempo, volumes, voices, instruments. Oh, I put tempo in there twice. and mood in order to gain insight on an issue, express the inexpressible, learn about their thoughts and feelings, or process something important. And I put, like, you know, oftentimes it's easy to get focused on lyrics, but sometimes, like, there's a lot going on underneath what's happening with the words, or what's happening with the voice quality. And you can really talk about some interesting stuff. In particular, like, sometimes music sounds really happy, but the lyrics don't even match, which you could really have an interesting conversation about masking when we're really feeling sad, angry, disappointed, ashamed, all of that. Same thing also with the instruments that are used, what we're drawn to, the mood. And then if the tempo is, you know, going fast, slow, or disorganized or organized. So I have a couple of examples I just want to share with you. And please know, like, from our conversation, like, there are so many different avenues and there's so many different music preferences. I figured this would kind of give you an idea of how I use music and then go from there. So this first example is a recent example. It's the song Beautiful Things by Benson Boone. It's pretty popular. It actually just came up this week with a kid. I'm going to play you a little bit of it so that you get it in your head and you see some of the lyrics. And then I'm going to tell you about kind of goals you could use it, themes, and then how I used it with a kid and how it came up. Is the music playing?
No, I think you have to share your audio as well.
Okay, give me one sec. Thank you, Heaven. Let me see. New share. Should. Yeah, it's computer audio. Let's see if this will do it. Uh-oh. All right, let me try one other thing. This would happen. Go to advanced. Let me go to computer audio. Let me go share.
It's on the Zoom settings, like at the top.
Oh, it
where you-
is?
Yeah, at the top, like right hand corner, I think, of the Zoom window. After you hit share your screen, it should be a something you can click on with a drop down that says share audio.
Your sound. Yeah, I do have that.
And then if you have an earbud in, you got to take that out too.
Yeah, I don't have the earbud in. Let me see. Oh man, this would happen. I wonder why.
I'm looking for my end too.
Thank you.
So when I used to do that, I would click
Mhm.
out of your YouTube. I would go back and share it. And when you see the share button, you'll see all these different screens, including that screen. At the
Okay.
bottom, it should be a click, a little like share audio. That's when I used to do it. So I'm not too sure if you can
Okay, let
now
me.
hit share screen,
Okay. Let me
and
see.
then you should see the a sub screen inside of it.
Okay. Let me see. Oh,
And
okay. Hold on. Let's see here. All right. And then I'm just gonna do real quick. I'm gonna stop sharing. Oh, okay.
You did it.
Can you hear it?
We just did.
Okay, but you can't see it, but you can hear it?
Yes.
Okay, we're just gonna do that. All right. So I'm just gonna play a couple of bars so you can get it into your ear.
Thank you, Stacy.
Thank you, Stacy. Okay.
For a while there it was rough, but lately I've been going back. December, I recall. And I see my family every month. To come and stay. Think I might have it all. And I thought,
It is breaking up. I don't know that anyone can hear it,
It
honestly.
is.
Yeah.
All right. So what I'm gonna do, I am going to go, we're gonna fly by the seat of our pants. I'm gonna read you some of the lyrics and then I can talk a little bit more. So the lyrics to this song, it's for a while there, it was rough, but lately I've been doing better than the last 4 cold Decembers I recall. And I see my family every month. I found a girl my parents love. She'll come and stay the night, and I think I might have it all. And I thank God every day for the girl he sent my way, but I know the things he gives me, he can take away. And I hold you every night, and that's feeling I want to get used to, but there's no man as terrified as the man who stands to lose you. I hope I don't lose you. Please stay. I want you. I need you. Oh God, don't take these beautiful things away. And then it's a repeat of that. So let me pull. I appreciate y'all bearing with me in this technical stuff. So for this, when I look at this song and some of the lyrics, goals that I would think if I were going to use this maybe in substance abuse or somebody with trauma and providing psychoeducation about maybe underlying schemas, maybe how our thoughts might be impacting our relationship or be getting in the way. Safety and security in relationships, those might be the things that we're really focusing on. And then themes that I pick up, and there's probably more, is that this sounds a little bit like a trauma response. He's thanking God for this lovely relationship, but also he knows that God can take this person away. And he has this moment of like, please stay. I want you. I need you. Don't go away. It's this fear of abandonment, this fear of losing somebody. Also, kind of catastrophizing a little bit. And so we as therapists know, like, if you have this response and you're in a relationship that's working out, you could really shoot yourself in the foot. So it's a great, beautiful song, and there's a lot of emotion in it. And so I had a kid who I just started seeing, who we were doing a spot the emotions game, and the question was, what's your favorite song? And she said, Beautiful Things by Benson Boone. And she just went right into singing it. So I got my phone and I put it on, and I watched her as she sang and rocked, and I got to see her in the part of like, please stay, I want you and need you, like picture a little girl, being really into it. And and then we talked about it after. And some of the questions I had was, what do you like about the song? Like, what is the singer singing about? When you listen to the song, what do you think about? And for her, it was about her cat that she loved. Very innocent and pure, but it brought up all of the losses from previous pets and her fear she was going to lose her cat. And what emotions do you hear? And like really happy, and then thinking like, well, maybe like sadness, anxiety, fear, kind of mixed up. And then, if we would have had time and it wasn't, this sort of initial like getting to know you, I might have asked, if he was a friend, what would you say to him? What do you think he would like to and need to hear? Using her as an inner resource of coming up with that, because she might need that. And who does she get that from? And who will help support her when she misses her cat, or worries about her cat dying? And what kind of information is she getting? So I really like this song, and this is like just spur of the moment, like let's put on some music and go. Let me see. Abby, thank you. It says you may have to mute yourself with sharing. Okay. We'll try it for the next song and see how that goes. This next song as well. So this is one that I personally like and I think can be really powerful for ourselves as therapists. I'm gonna play you, hopefully. I'm gonna stop sharing and I'm gonna play with you what it sounds like. Who are you leaving the lights on?
Yeah. No, that muted the whole thing.
How much more electricity do you plan on wasting because you're looking so burned out?
For some reason, it's breaking up.
Okay. You have the choice. Okay, that's fine.
I'm sorry.
No, it's okay. I gotta figure it out. So this is a song by Desiree Dawson. She does a lot of really great music, predominantly on self-care, self-identity, self-compassion. You know, it's not necessarily for everybody or everybody's preference, but what I find is that it can be really useful in a variety of different settings. So goals and themes addressed, observing automatic thoughts, schemas, shifting perception of an issue, improving relationship to self, increase self-compassion and identity. And lyrics that kind of come up in this song are, you know, the mountaintops wait for your arrival, not just your survival, and who you left those. So sorry, let me start this again. So the lyric is the mountaintops wait for your arrival, not just your survival. This idea of, you know, we're in such a survival mode that we kind of negate the joy, the slowing down, the centering to self, and you can come wholly as yourself and have balance. There's also a lyric of, who left those lessons in the beat of your heart, teaching you that yes is the only answer? It's not the only answer. This idea of learning, you know, to say yes all the time when maybe we can say no. And especially as adults, maybe we can say no. Or as teenagers, maybe we can say no. And then there's a message, there's this lovely chorus of, do you know who you are? Do you know who you are becoming? And so what you can find is there's this theme of self-compassion, self-exploration, advocacy, self-care, but there's also this review of progress so far. The journey up the mountain, you can't really see the top until you're there. And so it's a great way if you've had a client coming in, or if you've been a therapist who finally got their license and you're kind of like, oh my God, what is life? It's great to look back of all of the things that you've learned and are able to see like, this is who you're becoming. You're not, you know, even though you're fresh and it feels new, you've done a lot of work. And so let's rest and celebrate here. And there's a lot of things that happen in the music that can be really supportive. A lot of it's piano based, soft. She's got this lilting voice that kind of happens. And a lot of it's almost repetitive, almost like a mantra or an affirmation. And so you can kind of take out from that. Other ways of using song listening and discussion, you can create a playlist, you can do a review of a playlist as well. And we've already kind of talked about that, but even a review of a playlist could be really interesting, particularly for those folks who I mentioned, older individuals that they've worked with. You can, and narrative as well. A couple people use narrative therapy. You can do like a life history in music, things that, like, what was a song that you listened to a lot in childhood? What was a song that you listened to in adolescence, in adulthood right now? What do you want your legacy to be? So you could do a life in review as well, which can bring up a lot of sense of accomplishment, but also fear, or even a desire, like solution focused, like I was here, I want to be here. So song listening and discussion on paper is simple, but you can do so many things with it. Um, ooh, on. Next, I have songwriting and lyric rewriting. So songwriting can be writing lyrics with or without a melody that has a specific tempo or not. It can be organized or spontaneous. It does not have to have a rhyme, nor does it have to sound pretty. It's a form of expression. However, it's created with the purpose of being able to reproduce it again. So, oftentimes songs can be, motivators, energizers, things that really pump us up and get us going. And so songs that come from the self can be very powerful. It's in our own words. And so it doesn't have to be in tune. It doesn't have to always be in tempo, but it's meant to be reproducible or recordable. Lyric rewriting is when a client or the therapist rewrites a song to meet a specific goal being addressed for fun, like a parody, or for additional insight. So we'll talk a little bit about that. So this next song, since I know it won't play, I can send a copy of this presentation if people want to click and do that. I'm more than happy to give that to you, Karen. This next piece is really lovely. It's a little bit older, but I've used it before with as young as the age of like 12 and older, and particularly with girls. It's I Am Light by India RE, goals addressed to self-expression in esteem building. And the invention is to listen to the song and then discuss the lyrics, have the individual rewrite the lyrics and describe themselves, discuss how positive affirmations increase self-esteem and improve interpersonal relationships. So I Am Light, let me pull up the lyrics so you get a sense for it and how I've kind of done it. So the chorus is I am light, I am light. And then in the verse, it goes, I am not the things my family did. I am not the voices in my head. I am not the pieces of the brokenness inside. I am light. I am not the mistakes that I have made or any of the things that have caused me pain. I am the pieces of the dream I left. I am not the pieces of the dream I left behind. I am light. I am not the color of my eyes. I am not the skin on the outside. I am not my age. I am not my race. My soul inside is all light. And then the end is, I am divinity defined. I am the God on the inside. I am a star, a piece of it all. I am light. So it's talking about the things that she's not, and then the things that she is, which is great for self-identity. It's great for interpersonal relationships. It's great for esteem building, and it's great for affirmation. Like, I'm not this, I'm this. Just because I did this one thing doesn't mean that that defines me. And so you can literally take the lyrics, and for every place it says I am, you can change it to something else and have a really great conversation about it. And it's really powerful, especially in a group setting. This next one, oldie but a goodie. So I've used this with older adults. I've stolen this. Bad Moon Rising. So that one's like, I see a bad moon rising. I see trouble on its way. So esteem building, self-reflection, changing perspective. And for this one in particular, you would ask questions like, what cognitive distortions can you identify in this song? Do you ever feel this way? Like the other shoe is gonna drop, that you see bad things coming your way? In what ways? How do you cope? How would you rewrite the song to be more positive? What's the reframe? How would you reframe what you're seeing? And what advice would you provide to the singer? And it's really, this one you could literally just get a karaoke recording of it and sing the new lyrics if you want to. So it can be a lot of fun. I've used this in primarily with older adult men, older veterans, some substance abuse. So it's kind of silly and fun at the same time. And it really gets them kind of thinking about their thoughts. Songwriting by your individuals. So again, you might find that your individual has written a song and they want to share it with you. Let them share it with you and talk to them about all of the things you hear. Enter with a lot of curiosity. I remember working with a teen who really, he was getting into a lot of trouble at the agency. And he also was a deeply sensing kid who really needed a place to process. And I think because he was processing, he was acting out. And so we used his music as a way to process his experience and how hard it was to find balance in his life when he left, and to not return to being part of some of those old behaviors and groups, particularly as they relate to gangs in the Richmond area. We also talked about his relationship to females and how he, respected them versus disrespected them and how he wanted to change that. So you can, and sometimes I'd even talk about the beat, like, what did you pick this beat? Oh, I just thought it was cool. Well, I'm curious though, like this thing happens here while you're doing this, like what is happening? What do you think is so important that you put this lyric here? It gets them chatting, insightful, and they're like, oh, like I didn't think about that. I'm going to try this. So you could totally use that clinically to helpful. And again, it's them bringing it to you. They feel safe and secure to bring it. So use it, take advantage of it. And some more questions, who do you picture singing this song? Is it you? Is it somebody else? What music would you accompany? What's the song about? What prompted you in the first place to even do it? Like, be curious. Sometimes, we're inspired to write music. I don't write music a whole lot, but during big parts of my life, I've written songs or made up spontaneous song, like words. So lots of different things you can do with this. Music and meditation. So what is it? Meditation is the practice of focusing on the present moment and clearing the mind. Music can increase the practice through focusing on a particular melody, sound, lyric, or rhythm. It can also intensify present moment experiences, particularly as they relate to the body. Sometimes people think it's just about clearing the mind. Sometimes it's really about getting into the body and connecting. And so music can help support that as well. So sadly, I won't get to give you an example of what this looks like, but I can tell you a little bit about how I use my voice musically, in particular with this area. So typically, like when you're using this, as I'm sure a lot of you have, and feel free to type in if you have used music and meditation, like how you're using it, what you're doing. You can use a very specific script. About using imagery. So you're at a waterfall and you stand in front of the waterfall and you just notice how calming it is. You could use body scans, so going from the toes all the way up to the head, either by tensing and releasing. It could be through visualizing color. It could be visualizing heat or cold. I actually had an individual who has something similar to like Raynaud's disease or POTS. So they get overheated really easily. So we're not focusing on heat on the body. We're focusing on imagining that there's cold, which they're finding, our brain isn't able always to differentiate the difference between like reality and non-reality. So, our brain is this powerful thing that if we imagine it, our body can have a reaction depending on how powerful it is. And this can be used positively or negatively. So what I tell clients is when we use it positively, we can actually kind of shift where we are and reintegrate the experience. So for this individual who needs cooler stuff, we focus on cool imagery. We don't focus on the hot because that might exacerbate it more. Just as much as like, if we're fantasizing about like a juicy burger we want to do when we want to eat, our salivary glands kind of peak up. So you can do the same thing also with the scripts that you use as well, so that their body learns to kind of respond and know. And then you can also kind of do it improvised. So I tend to use scripts, but I also have my own way of doing them, so they're more organic and they're more present focused, and I don't feel like a robot. So I pay a lot of attention to my vocal quality and volume and pacing. And I'm also focusing a lot on nonverbals and breathing. And typically what I'll also pay attention to is if they're deepening the experience, I'll notice if they're shifting a little bit. I might also notice if they're swallowing quite a bit. Oftentimes that's kind of an indicator that they're in that almost non-ordinary, quiet space of being clear and focusing attention and awareness. I also will offer, when I'm using music, I will have prompts. So I might say, invite the music into the body to relieve the tension. See if you could really breathe in the music into the body, into all that tension, and see on the out breath if you could take it in. I might even say, see if allow the music to support you as you notice the tension in your body, and see if it notice how it amplifies or decreases it. I might also just let the music kind of be there with a lot of space. Sometimes the silence can be a lot for individuals, so having music just as a quiet support is really helpful. And then I'm thinking about the quality of my voice too. So if I'm working with older gentlemen or older women, I don't want to be a high-pitched voice. I want to be lower, especially if they have hearing issues. It might be that somebody really needs you to be present, focused on them. So I might get a little bit closer to them and really focus on being very clear and concise and have more of a clipped tone to my voice. Other times it might be just a lot more space. Oftentimes I'll even ask people what works for them. So I might say, are there any words that kind of make you tense up? For me, anytime anybody tells me to relax, I do the exact opposite. So I'll ask if that works, or some people I've had say deep belly breath, so I incorporate that into what we're doing, because it's their inner resource and we're trying to deepen it. The link that I have in here is a very short 2-minute piece of music, and there's a little bit of stuff happening in it, but not a whole lot. So when I'm picking the music, I'm very particular about what the goal is and why. So sometimes, particularly with scripts, and you're using imagery, it might not be that you necessarily just want one chord the whole time. It might be that you want a little something else going on with melody line and rhythm, so that they're able to deepen the experience and you can leave more space for that to happen. But that also means you have to know the piece of music pretty well to allow the space. Body scans keep it pretty just supportive, quiet, all of that. But if you really want to be creative and think about kind of what the goal is, if you're trying, or say you're doing preparation. I had a music playlist that I would go through all the things I was going to do before I got my wisdom teeth out. I had very specific music for that I associated with it. So if you're mentally preparing somebody for something and choosing music, you really want to know the music and give them specific scripts to use. And then finally, music and movement. So what is it? This comes from Harvard University, talking a little bit about exercise. Your mind and body are intimately connected, and while your brain is the master system for your body's movement, the way you move can also affect the way you feel. So exercise has been shown to decrease anxiety and depressive symptoms. Bilateral stimulation has also been found to help rewire the brain from trauma. And movement allows for nonverbal self-expression, protection, and grounding. I think we forget how important movement is, and there's so much research now, particularly with trauma-focused therapy, of how useful it can be, especially from a bottom-up approach. I got a lot of overthinkers in my office, a lot of folks who get tense, but they're not even aware of their body. So music can really assist that. And it's really about finding the right music and the right intervention for the person. Doing a crazy dance and all of that, it's not for everybody, but for some it's great, especially kids. But for older adults, you can find interesting ways of using music. So freeze dance, everybody knows this. This one's really great for following directions. It can also be just for getting the amount of energy we have. I know somebody had mentioned somebody with ADHD. It's great. Or even just having breaks in which you're moving around and just kind of getting the head on lockdown to where you're going. As music therapists, oftentimes we train with individuals, so we meet them where they are musically, and then we slowly bring them down and they will actually entrain with us. So same thing with music and movement, you could do the same thing. Move to the music. So can you express the music that's being expressed through the body? And you can also do this with painting, drawing, and clay. So there's actually a song link in here by Sylvan Esso, and it's called Numb. And it's this song about let me shake out the numb, let me feel something. And she goes through all of these things about shaking the body. I haven't had a chance to use it yet because I haven't found the right person that's appropriate. I also have a connection with it. But it's a great piece of music that she literally is talking about just wanting to feel something instead of nothing. I actually have quite a few military people who talk about that. They'll have these periods of like just feeling really angry or really sad, and then like they just go to like shutting down, being numb, which is protective, but it's not working in their other places. So using music in a way, or can you express it in your body? Like what can you notice in your body? Like if your arm is feeling tense, does it have a message for you? And can you loosen up your arm? I'll do it with you. Let's just see if we can shake it out. Also music to help with transition. So thinking about, I forget who it was who works with school age kids. For little individuals, music is such a motivator that you can use it, especially like marching songs, cleanup time. You can do it like a song to like prompt that like something is ending. So as soon as they hear it, they know they gotta go. It can also help with moving from one place to another, even singing or rhyming something in which it's kind of silly. So lots of different ways that you can use these types of interventions. So before I get into contraindications of music, any questions? The other thing I can do as well is I can also wait to do questions after. Maybe I'll just go through contraindications first. I think I'm gonna do that. So individuals' preference of music. Sometimes individuals' preference of music can be helpful and sometimes it's unhelpful. So thinking particularly about recovery, there are old songs that trigger to drinking, trigger to gambling, trigger to X, Y, and Z because of the emotional content or attachment that they have to it. It could also be that it can be related to trauma and they're just replaying it over and over and over again, which is just making it worse, creating more anxiety, anger, and all of that. Also, sometimes, we like to have music that validates our feelings. And research is kind of finding that while it's good to validate that feeling, sometimes if you already have depressive symptoms and you're listening to depressive music to validate that, it can actually worsen the depression. So you kind of want to investigate a little bit with your individuals about how they're using the music and why and what it might be supporting or not supporting, and see if, you can find alternative ways to use music. So I always want to be careful about that. And some of the other things we talked about. Music triggers. So the melody, the percussion, the instrument, the quality of voice, etc. In particular, so this might happen to you using music. I actually had a number of years ago working with an adolescent. She wanted to process her sexual assault through songwriting. She's a really great songwriter, which was very helpful for her processing, and it allowed her to self-advocate for herself and share what was going on. However, it was a very catchy tune. And so I would work with her and then I'd come home and the song would be stuck in my head. That was a bit of a musical trigger for me, and I had to really find a way to reprocess that so I wasn't bringing it home. And it was the melody, the rhythm, everything, and then also the lyric content just kind of stayed there because it was very catchy and it rhymed. So we want to be aware of that and just know that, you know, for the I think it was maybe Heaven who had talked about nervousness, you know, making sure that if we know there might be some blind spots, having time at the end to ground. Sound triggers, so how loud or quiet it is. So thinking about some of our neurodivergent folks, but also our trauma folks. Sounds, yelling and fighting sound bites, nature sounds, doors opening and closing. A lot of our music has gotten so creative and expansive over time that they have these like weird sound bites that like can trigger you. Heck, I've been really anxious where I'm listening to a song and I hear like an ambulance or a cop car and I think it's behind me. It's not, it's the freaking song. So we want to be aware of that, especially if it's music that we pick, because it might amp up people a little bit. Limitations to participation, so minimal reading and writing skills. So we might not want to read lyrics with our client if they can't read, or we might not necessarily, we might have to really figure out, like, can't give them a homework assignment to write a song if they can't write, or they have issues or limitations. Same thing with difficulty with hearing, and then difficulty with sharing others. So we really want to think about that. So thinking of Heaven's thing with, like, you know, some people don't want to necessarily process this in the group. We want to think about how we can make everybody participate and how keep a safe and secure environment. Consent. So in particular, if you choose to do recording for whatever reason, you always should get consent to use that in another setting. Same thing also with lyrics that are written, poems, X, Y, and Z. You know, this is the individual's intellectual property. This is their voice. This is X, Y, and Z. You really want to be mindful of that, that you're not just sharing this with whatever. You still have to be HIPAA compliant, no matter how beautiful a song is or sounds or the lyrics or whatever else. You always want to ask for consent from your clients. And then, of course, your own countertransference and bias about the music that you or your client chooses. So again, there are certain songs that are blind spots for me that I would not particularly bring in unless it was a preferred song for a client. And again, I'd be sort of prepared in general for. Same thing as well, like having experiences with music. You know, as somebody who uses music a lot, it's easy to like have your relationship with music change where you're constantly thinking interventions. So you want to just kind of be aware of that. And you also want to make sure that, like, when you're working with individuals and music, if something stirs up or you're finding that like you're just kind of listening to music that's your clients all the time, go back to listening to the music that brings you back to self. Because it's a powerful modality. It's the same thing with art, poetry, movement, all of that. Make sure that what you are providing support with, being witnessed to, engaging in, you're balancing it out for yourself as well. That's why it's such a powerful entity. Sometimes it's easy with talking, not all the time, to kind of compartmentalize. With the arts, it's a little bit different sometimes. And so, are there any questions? I feel like I gave a lot of information. There were some technical difficulties. And I also am aware of time, but I want to see it, how else, what questions you have, all of that.
So do you use like a computerized auto tune or something like that, a music maker with your clients?
Currently, no, but you could totally use it. Especially if it's something that they're into and it's fun. Like if they have an app and you want to engage technology, you could totally do that and have a little bit of fun with it. You know, there are aspects of play in music making. And so if that's their strength, you can totally do that. I've also used GarageBand. I've gone and picked out beats on YouTube and just let kids pick out beats and talk about them and do stuff over them. It's really how you want to be creative. It's really easy to spend a lot of money on like music making things or software. Um, Sometimes you don't always have to do that. Sometimes like, problem solving like with the resources you have can actually be really helpful.
I have a question. This is
Yeah.
so do you have any like suggestions on like music selections in a like a cultural setting, because I see clients that are like from different ethnic backgrounds. And so sometimes like what the majority would listen to versus like what they would listen to is different. Do you have any like ideas or suggestions about how to handle situations like that when you're working with diverse population?
Absolutely. So part of it comes from like curiosity. Like, so if they're if they say they're say like from Colombia, South Africa, I don't know, Ireland, whatever else, you could say, hey, I'm really curious. Tell me a little bit about the similarities and the differences between music in the United States and where you're from. Tell me a little bit about some of the traditional music that you might listen to. Are you into it? Are you not? Um, Tell me a little bit about um, music that amplifies and celebrates your culture and your upbringing and where you're from. What kind of music would do that? Um, you can find kind of unique ways of having them talk about themselves through their music. You can also ask about like what kind of dance songs are popular, where you're from. Oftentimes there might even be a cultural dance associated with it or a cultural tradition as well. You can get into talking about holidays or celebrations or rituals. So it really depends. This is where we lean really hard on individual preference. And then also like particularly in groups, right? Setting those rules about being respectful, about listening and being curious about other people's music. So you could even prompt other people to be like, I want this group to be curious about why this song was selected. So like maybe ask some questions about something that's, what's meaningful to this individual, or how often do they listen to it or not.
Thank you for
Yeah.
Well, thank you so much, Nicole. I think this was a very enjoyable presentation. It's always nice to have different ways, different ideas, and how we can, incorporate things and communicate with our clients differently. I think I put in the chat for everybody. Please make sure your name and email address is there. We will be sending you a certificate and also a slide. Somebody had requested the links to the songs, so that will be in there. And I appreciate everybody for attending, and I hope you guys have a really great day.
Have a great day, everybody. Nice meeting you all and talking to you all.